Hi everyone, my name's Taylor. I'm currently a student intern with the Counseling Center, and during this past semester I had been working on developing a workshop that I wanted to present to the campus. This was focused on how to educate and recognize signs and symptoms in a friend that you may suspect is experiencing a mental health condition. And I just kind of wanted to start off with some basics, such as how to properly educate yourself and some things to be looking for when first recognizing this. I will have a couple other videos coming out about this in the future. So first I wanted to focus on clinical depression. I know that this is a highly recognized mental health condition on college campuses currently, and that a lot of the younger generation faces. It can manifest in many different ways and look different for multiple different people. But overall, depression ranges in seriousness from mild, temporary of sadness to severe persistent depression. It is potentially known as a major depression or major depressive disorder, and it is not the same as depression caused by a loss, such as a death of a loved one, a medical condition, or something such as a thyroid disorder. Symptoms are usually severe enough to cause noticeable problems in relationships and day-to-day activities. I also wanted to point out that we should be looking at reliable sources if you're trying to look into this yourself, such as the National Institute for Mental Health. I know that usually .org is what we would be focusing on. So clinical depression continued. Some early warning signs that you might be recognizing someone are tiredness and lack of energy, feelings of sadness, tearfulness, or emptiness, trouble thinking or concentrating on day-to-day tasks, along with being angry outbursts or having some irritability or frustration that is a bit uncalled for. Also, some general warning signs that we could be looking for are loss of interest or pleasure in most normal day-to-day activities. They might be having trouble sleeping, reduced appetite and weight loss, or the complete opposite in cravings of food or some weight gain. They may be experiencing anxiety, some slow thinking, also frequent or reoccurring thoughts of death that they may be expressing to you. This also may not occur at all. And then also unexplained physical problems such as back pain or headaches. And finally, some preventative measures that one can look to take when experiencing this or recognizing this in someone is speaking with medical professionals, having hobbies that you're interested in, ensuring that you have a good support system around you, whether that be friends, families, professors that you trust in. Also seeking help when you first start noticing that you haven't been yourself, and also engaging in some day-to-day physical activity. Moving on to anxiety, this is another widely recognized mental health condition that a lot of students face currently. People with anxiety disorders frequently have intense, excessive, and persistent worry and fear about everyday situations. Occasional anxiety is a normal part of life, but there's a point to where it starts to manifest and become something that's a deeper problem. And then examples of anxiety disorder includes generalized anxiety, social anxiety, and then like certain phobias of specific things. Some general warning signs of anxiety do include feeling nervous or restless, a sense of impending danger, having an increased heart rate, sweating, feeling weak or tired, sometimes having trouble concentrating or thinking about anything other than that worrying, along with having difficulty controlling worry and having the urge to avoid things that trigger anxiety. And that's all that I have for you today. This is just part one of the presentation series that I will be going about, and I hope to see you next week.